number has gone flat, so we hope that you'll all be able to stay logged on throughout the duration of the webinar. So my name is Elizabeth Lamb. I'm the Partnerships Manager of Breaking the Glass. Breaking the Glass is a diversity and inclusion initiative created by Computer Futures. Computer Futures is a contract recruitment company, so we place in contract talent for Adobe, Salesforce, business development, mobile, various software development languages. And about 5 years ago, when Computer Futures was getting their offices sorted in the United States, they wanted to make sure that they were really impacting cultures the best way possible. And through that, they wanted to create a space for conversations around women's career development and diversity and inclusion in the workplace, because as recruiters, they have a big responsibility for the cultures that they create at, or the cultures that end up being created at organizations. So they wanted to make sure that they were doing everything they could to have a positive impact on that. So they started doing one-off events, first around the Austin area, and then this past year we've launched nationally, and now we're able to operate beyond just our our operating cities of New York, DC, San Francisco, Austin, and Denver, with the strange upside of the situation we're all in. We get to have these webinar programmings and really just break down borders and be able to access just a larger audience. So we've been really excited about that. So obviously May is Mental Health Awareness Month, and we wanted to make sure that we were touching on this topic as well. Natalie and I got connected through a mutual contact, and we got on the phone and she started telling me what she's doing at Rock Springs and everything that they're doing to make sure that everyone has access to mental health services, and how the landscape for clinicians has pivoted. So pretty much I was like, hey, let's do a whole webinar just about it. It sounds like this conversation definitely deserves its own space and time, and so we're really excited for that. So Natalie, I will let you get going. I'm gonna minimize my screen, and if anyone has any questions, I will be fielding those along the way and sending some information through the chat. All right, bye.
Awesome. Thank you, Elizabeth. And thank you, everyone, for joining us this afternoon. I know we could not share this information quick enough to be able to allow everyone to kind of partake. And thank you to the ladies that are on this panel as well. Yes, like Elizabeth said, happy Mental Health Awareness Month. As we all know, or if there's some people that don't have a big background or extensive knowledge in mental health, this is a huge month for us in making sure that we're bringing awareness, we're reducing stigma, and again, removing barriers and opening up access to these services. So I'm gonna start off by introducing some of Rock Springs community allies in no particular order. And then as kind of shared in the agenda, we will just go through some Q&A. And then of course, if there are any additional questions that maybe we didn't cover, or of course, topics that you want to ask the ladies, feel free to put them in the chat box, and then obviously we'll leave some time at the end to cover that as well. So I will go ahead and get started with Miss Deborah Roberson. She is a Texas licensed professional counselor and a nationally certified counselor. After 8 years as a solo entrepreneur in private practice, following 4 years as a career coach in higher education, she opened up Thriveworks coaching and counseling group practice in 2015. She now leads a staff of 45 outstanding mental health clinicians to help their clients live happier, more exciting, more fulfilling lives. The entire operation made the pivot to work remotely via telehealth at the onset of the COVID pandemic. The clinicians at Thriveworks have specialties such as individual, couples, marriage and family counseling, child and adolescent therapy, as well as LGBTQI friendly. They have some bilingual couples and marriage and family counseling. Oh, sorry, I'm going over. Bilingual speaking counselors, excuse me, drug and alcohol counseling, career and life coaching, and psychological testing services. So Thriveworks has quite a bit of things that they're able to do and offer to our community. The clinical team provides concierge level access to counselors with appointment within 24 hours. personalized premium care. She oversees 5 office locations to choose from in Central Texas, and she believes every client has the ability to thrive. So welcome, Debbie. Thank you so much for being with us this afternoon.
Thank you for having me.
I'm gonna introduce Sandy Hollier, LCDC. She has been involved in the field of addiction treatment for over a decade. She has gained valuable experience in a myriad of roles, including executive director, director of admissions, assistant director of business development, utilization review, and counselor. She is also currently the director of business development at the residential treatment center, the Arbor Behavioral Health. Sandy embraces holistic practices and believes that any addict can recover through proper treatment of mind, body, and spirit. Her approach to healing includes helping another embody their feelings, thoughts, and perceptions from the inside out. She strives to help others access their authentic experience and process it emotionally, cognitively, and spiritually. Sandy holds a degree in business management and is a licensed chemical dependency counselor. Sandy's years of experience combined with her own recovery journey has strengthened her passion for helping others change their lives. As director of admissions and business development for the Arbor, she matches the spirit of healing with the insight of strategic partnerships. Sandy enjoys golfing, hiking, traveling, and is a board member of the nonprofit organization benefiting men and women in recovery. So welcome, Sandy. Thank you for joining us.
Hi, thank you for having me.
So next, I'm going to introduce Dr. Diana Samuel. She is a board certified child and adolescent psychiatrist, as well as board certified in adult psychiatry. She is the co-owner of North Hills Psychiatry and also co-owns it with her sister Zita. And she has been offering teletherapy for roughly a decade. So she is definitely knowledgeable in this kind of webinar that we have going on. She graduated from Ross University Medical School and completed her adult psychiatry residency at Baylor College of Medicine in Houston, Texas. She has always been drawn to helping children. So of course, she wanted to go back to school and complete her child and adolescent psychiatry fellowship at the University of Texas at Southwestern in Dallas, Texas. Before moving to Austin, she had the opportunity to serve as a consulting psychiatrist for the Dallas Independent School District, one of the largest school districts in Texas. She was able to connect with the students and their families and prepare them for success in school and life. Now that she has her own practice, she is able to utilize the best aspects of her training and experience, yet maintaining the flexibility to spend an appropriate amount of time needed to help each child. So thank you, Dr. Samuel. Welcome.
Thank you. Thank you for having me.
And last but not least, I will introduce Dr. Erin Vaishali. She is a licensed psychologist with over 10 years of experience as a director of outpatient services, a staff psychologist, as well as a director of child and adolescent services, director of clinical services. Additionally, she now serves as Rock Springs Chief Operating Officer and is our director of clinical services. She started with Rock Springs in June of 2017 as the director of clinical services. She additionally, now in addition to holding that role, is our chief operating officer. She provides clinical and administrative oversight for day-to-day operations. Erin has been vital in implementing Rock Springs COVID protocols and procedures, including the rise and adoption of telehealth services for Rock Springs, mental health and substance use programs during this continuously evolving pandemic. So welcome, Erin. Thank you for joining us today.
Thank you, Natalie.
So real quick, before we get into our questions, I just kind of want to review what Rock Springs does as a whole. If you're not familiar, Rock Springs, we've been open in Georgetown for just over 6 years. We offer inpatient and outpatient services. Our inpatient services have a little bit of an update. If you haven't heard, at the end of April, we expanded our adult inpatient services to include adolescents. So we now serve ages 13 and older in an inpatient setting. And then for outpatient, we have 2 locations. One is located next to Rock Springs in Georgetown. And then we have a newer location that opened in January of 2019, which we refer to as Changes in Cedar Park. They serve as young as 8 all the way up to whatever age. So again, we'll get into kind of specifics about, outpatient versus inpatient. And I know we're going to review about how each kind of different entity on this webinar is using telehealth services or teletherapy. So I will be quiet other than kind of asking the questions to our panel, but let's go ahead and get started. So we've kind of mentioned in everyone's bios and things like that, and obviously in the shoot out of this webinar, but I don't know if everyone knows the definition of what teletherapy or telehealth really is. So Dr. Samuel, let's start with you and you can get us started. So what is that? What does that mean?
Great. That's a great question as well. So if you look at the word teletherapy, you mentioned teletherapy and also telepsychiatry. I want to take that first part of the word, which is tele or tel, and that's a Greek prefix for at or over a distance. So if you think about that word telehealth or teletherapy, you're providing therapy at a distance. So teletherapy, you're providing therapy at a distance. Telepsychiatry, you're providing psychiatric medical services at a distance. Now, those are more specific terms, and recently they have other terms have evolved as well, for instance, such as telehealth, which is social care plus medical care, and then also telemental health. All of these words are used interchangeably. So even the World Health Organization differs in their definition of what telepsychiatry is versus telehealth in other organizations as well. So I really want people to focus on that first part of the word, which is just amazing that we can actually provide these services from afar and from a distance. And it's important to think about how this actually came about. This just didn't start here since mid-March. This telepsychiatry, telemedicine has been around for over 2 decades. And it was originally designed to meet mental health needs of users in remote, rural areas where good medical care was inaccessible. So it helped deliver these range of medical services, high quality medical services, to people that wouldn't normally get it if they weren't living in a big city or weren't living near a big medical institution. So it really helped with the equality of access. And I really want to make sure everybody here that's listening to understands that this is equal access to care. And that's important because there's some misconceptions as well that teletherapy or telepsychiatry may not be as good as an in-person visit. Now, certainly there are some limitations, but numerous studies have shown that teletherapy, telemedicine, telepsychiatry have equal outcomes with clients that are also doing in-person visits as well. So I think that's important to stress. And fast forward to today, where we're using it because of necessity, because of the pandemic that we are experiencing right now, this very unique circumstance that we're experiencing right now. So now I think more people are being introduced to it, but it has been around for a while, and there have been studies that have shown that it has been just as efficacious as an in-person visit for different types of diagnoses. So I'm excited to see how this continues to unfold, through this pandemic and after this pandemic. I'm excited to see how we continue to take these services to people that normally wouldn't have access to it.
That's awesome. Thank you for that, Diana. So Erin, do you want to talk about a little bit how we pivoted at Rock Springs to offer teletherapy, telehealth services?
Absolutely. So just like Dr. Samuel mentioned, I think telehealth, teletherapy, telepsychiatry is a wonderful way to break down access barriers for patients that need these services. Traditionally, maybe it was used for if there was a distance barrier, as she mentioned, but now it's amazing to see that people that are having anxiety-related concerns, maybe as part of their symptomology, their mental health issues, leaving the home is distressing. Now we can access them in a comfortable environment for them. If they're, related to COVID, if they're concerned to leave the home for medical safety issues, now we can provide access to treatment in their safe environment. And telehealth can be offered for a variety of different treatment modalities. It can be really effective for one-to-one care between a psychiatrist and a patient, or a therapist and a patient. But we've also here at Rock gotten really inventive on using some HIPAA compliant platforms to expand it as well to group-based therapy. Especially during this time when a lot of people are feeling very isolated and alone, being able to provide a sense of community and a support system, although it be maybe, virtually, having group-based outpatient PHP and IOP services happening daily helps sort of fill some of those voids for people in their lives.
Thank you for expanding on that a little bit more. So both really on what both of you ladies touched on is because of the virtualness, because we're so used to doing in person a lot heavier, right? Doesn't mean it didn't exist before, but the norm was in-person therapy. So how do we keep our clients, our patients engaged during this change? And is there a difference between adults seeking therapy, right? Those of 18 and older, or is it harder to get those kiddos engaged? So let's kind of talk about that. How are you keeping your clients engaged during this kind of wave of teletherapy? And is there a difference with regards to adults versus kiddos? So Debbie, let's have you answer that question.
Sure, thank you. I'll underscore what a lot of you have already said. The telehealth is a very effective model. And we have our clients that have social anxiety that are completely thrilled with not having to get out and see people. And so some people are really doing quite well. And for those that have had more depression or ADHD, maybe they can't focus, this is like so easy for them to just like click the button and they have the services. But for children, it is more challenging, for sure. The smaller children, you can't get them just to sit still and look at a camera. That's just not realistic. So some of our child therapists have kind of pivoted to a model where they're working more with the parent. So the parent's there with them, they're doing more parent coaching. Maybe the child is playing right next to them, or maybe they have the parent engage with the child in a game. I know our child therapists do a great job, like with puppets and other tools. They have little Jeopardy games they can play for the middle school and high school kids. So there's a lot of other tricks of the trade to keep that client engaged. But for our adults, they're getting the same exact service as if they were sitting right across the room. So that part I think is very much the same. But the children, it is a little more challenging. We've had some younger kids where we can't work with them. We just have to kind of come to that decision with the parent and just make a decision. Okay, the parent can come in. We're happy to talk. I say come into the telehealth and have that session, but some of the smaller children are not really able to get exactly what they used to get in a play therapy type model.
So Debbie, with that, what age range have you seen, and speaking more of like the child and adolescent age, that it may have been a reduction in clients seeking services during this time because it's been tele, or have not been able to be as engaged, or if at any, because you said you're able to loop in parents. So has that really not made a difference?
I think the very youngest children, like the under age 5, are the ones that maybe have not gotten as much as they did prior. The ones that we would consider play therapy candidates. Those are not the ones that are able to play and engage. So that's where we've pivoted to more of a parent coaching model for those kids. They may come in and kind of fly across the room, on camera. So it's just not quite the same. But if we can get the parent and teach our parents what they could be doing as that primary role model for the child, that's a win. That's a real win anyway. Yeah.
And that's a great way to kind of pivot, right? And change with what's been going on with this pandemic. So it's a great way to go to our next question. How have you, if at all, pivoted and removed barriers to still provide that much needed mental health and substance use treatment to existing and or new clients or patients during this time? So Debbie, I'll have you go ahead and keep on rolling and answer this question.
I think that's truthfully our passion at Thriveworks, is to increase access to mental health care. And since I partnered with them 5 years ago, I've opened 5 offices all over Austin, because part of the limitation to mental health care was driving across Austin to get to that appointment. So we're in the neighborhoods, in Cedar Park and Pflugerville and the Arboretum and South Austin and Bastrop. So we're physically more convenient. So we've always had this passion for increasing access. Now, truly, the doors are wide open. We can treat anyone in the state of Texas because our clinicians are licensed in the state of Texas. So I think we've already mentioned about meeting those rural needs. So anyone from anywhere in Texas, West Texas, we've had people from San Antonio that have recently started working with us. It could be anywhere. So this increase to access is truly fabulous. We have increased hours. Our therapists can work from 8 a.m. to 8 p.m. Not obviously every person, but someone may be working a morning shift and somebody's working an afternoon or evening shift, so that someone is available at any of these hours. And we have weekend hours, like from 8 a.m. to 6 p.m. So we're making, again, wide open doors, access to mental health care at all costs, whether it's the time of day or the geography. Those limitations are gone.
That's truly awesome, right? As we all know, not only on the panel, but also I'm sure attendees, access to mental health and substance use care always has struggles. There's always barriers. Distance is a huge thing about it. So that's a beautiful thing that, you know, not only Thriveworks, but everyone on this panel has been able to pivot and kind of adapt to allow access to care. So Dr. Samuel, oh, go ahead.
Well, one other thing, we've just had a recent trend that we've noticed. We are getting more requests by men, which is just, maybe it's a random uptick this last month, but all of a sudden men are feeling more comfortable because now they really don't have to go somewhere else and sit in a waiting room where someone's going to see them. They're in the privacy of their home. And I think that's a wonderful thing. If that is a true trend that's going to continue, that men are now seeking mental health care at a little higher rate than they did before.
And that's great that you mentioned that, right? Because yes, statistically speaking, stereotypically speaking, not a lot of men seek services. So removing that where they're not going to be in a waiting room, like you mentioned, is huge, extremely important. So that's great. That's really great that you mentioned that. So Dr. Samuel, although you've been doing this for multiple years, have you seen a change, or have you needed to adapt with, you know, maybe families being at home, right? And their kiddos always being there and their parents always being there. So why don't you kind of adjust with what you maybe have pivoted, and if you needed to remove any additional barriers?
Yeah, so I treat kids as young as 5 all the way through age 21. So I see kids with their families, and I also see young adults as well that are in college or their early careers when they've started working as well. And just to elaborate a little bit with Debbie, because I do primarily medication management with some supportive and educational therapy as well, I learn a lot of things from each interaction. So while I'm seeing a family in their natural environment, in their home, I'm seeing how the kids are acting in their normal environment. I get to see what's on their walls in their bedroom. I pick out something on their wall if they want to show something to me, and I get to see their artwork. So every interaction is just a neat way for us to learn and to feel more connected with our families as well. So I want to say telemedicine, telepsychiatry has definitely been helpful for me, and even learning more about my families as well. And like I said, it's been neat to see them in their natural environment as well. Now, as far as the barriers, you talked about barriers even before telepsychiatry, and, access to care, the stigma associated with psychiatric care, cost, time, establishing that rapport, and to, also follow what Debbie was saying as well. I feel like now that they can get access to it at their home, there's probably been a little bit less stigma associated with it. So we are seeing more men calling, so we are seeing these people that normally wouldn't have contacted an office, being able to contact us and not having to wait in a waiting room. I see teenagers where they don't want to see their high school friends in the same waiting room. So this is beautiful for them, where I don't have to worry about stacking patients that go to the same high school or same middle school together. So I feel like some of the stigma is hopefully being helped a little bit by people realizing, hey, this is easy to access. This is not something that is so hard to access. It's a little easier to access. I find compliance has been something that's been a barrier before as well, and not only with medication, but compliance with appointments. And so what our clinic has been doing is doing more reminders as well during this time, because days tend to run together. And when days run together, you don't know what day it is and what day, what time it is. And so we've been doing more reminders, and we've actually had almost a 95% show rate, which is very high compared to when kids have exams, or when parents have forgotten, or whatever life just throws things at you. So because of these multiple reminders to help with the compliance issue, we've seen almost actually 100% show rate in my clinic now as well. A specific barrier that I've had to work through is privacy. So in my visits, I see kids alone first, and then I see them with their parents. And for me, in their homes, there's not really a private area sometimes where they feel like they can talk to me about whatever they want to talk to me about. So the first thing I check in when I see my teenager, my middle schooler, my college kid, I ask them, are you in a place where you feel comfortable to talk, where you feel like you can speak freely? And I make sure that they feel that way. There are some times where they've said no. And I said, well, let's find a place. Can you sit outside? You know, can you use your headphones? And my office manager usually talks to the parents about that before our visit as well. But privacy has been a little bit of a barrier where we've worked through it. And a lot of the kids I've talked to have felt that they've been heard and that they could talk things privately to me without their parents overhearing them as well. And then establishing a rapport. We're not physically in front of them. So we're missing out on some nonverbal cues. We're missing out on that connection, being physically present together, but we are finding ways to make that connection and to, you know, help the families feel that they can trust us as well and that they're building rapport with us as well.
That's really great. I mean, some helpful reminders, right? It is much like you can see those cues in person, being able to look at their room and ask questions about that is really great to be able to dig a little bit deeper, although they may not, you know, verbally be sharing it. So opening that door is great.
Yes, and I also want to say, I just want to stress, when I tell families, studies have shown that this is an equal outcome to face-to-face visits as well. So some parents or families' perception is that maybe that they're not going to get the same benefit out of this versus an in-person visit. Let's hold off on the appointment. And I've been able to reassure them, and they have been coming and have been very pleased with the visits thus far. So
I love that. Continue to advocate for teletherapy. That's fantastic. So moving on, speaking of, you know, teletherapy services and how you need to pivot, remove barriers, things like that. Sandy, let's hear from you in regards to how the Arbor has needed to change and adapt during this time. What kind of teletherapy, telemedicine services are y'all providing?
Yeah, so I was listening to Debbie and Dr. Samuel, and something that occurred to me that's pretty, I guess, unique to our area of specialty, which we provide primary substance use treatment services. We do work with co-occurring mental health issues, most definitely, but all of our clients are struggling with some sort of primary substance use issue. And so we provide services from residential treatment all the way down to outpatient. And so our outpatient services are what we're currently providing via telehealth, that clinical component. And one of the unique barriers that we have faced is around using urine drug screens and breathalyzers as an accountability tool for our clients. And so while we have this great opportunity to have more access to clients who are outside of our local area for outpatient services, we also want to make sure that we are providing good treatment. And so that does include the urine drug screens and the blood alcohol testing for breathalyzer. And so what we decided to implement through trial and error was we ourselves in the admissions department will locate a lab within the local area of the client and help them get set up with a lab so that we can call them in for randoms and also do your routine drug testing and urinalysis on them. So that's been one barrier that we have been able to overcome. But every day, I mean, even just the increase in the census to our outpatient services has been a challenge because we have to reallocate staff, move staff around, make sure we're accommodating the needs of those clinicians in our outpatient program. Believe it or not, the administrative side of things going via telehealth actually is more than doing it in person because we have 3 or 4 counselors in the group. We have someone having to get them all set up on Zoom, troubleshooting any issues that come along. I see everyone nodding their heads, so I guess you guys have all experienced the same thing. It's also been fun and built camaraderie and teamwork to help navigate those obstacles and challenges. I love what Debbie said earlier, and I saw some of our audience, our participants chiming in that, you know, on the flip side of things, this has been really cool for those of us who struggle with social anxiety. And so we see a lot of clients actually opening up more when they're speaking through the lens of Zoom. So that's been pretty awesome to experience and to be able to navigate that with some of our clients. But I want to say this too, in addition to the intensive outpatient services that we're providing, the clinical services that we're providing, you know, working in substance use treatment, a big component of what we provide in the solution is 12-step recovery. And so we have a huge alumni following. We have to make sure we're providing services to our alumni, 12-step services in particular. And we normally had a group that met every Wednesday night in person to do a 12-step meeting. And so we also were able to accommodate that via Zoom, which has been so cool because at the Arbor, we have alumni all across the nation. And so we've seen alumni in other states able to log in and join us for alumni meetings who otherwise wouldn't have been able to do that. And so we've actually been trying to think of ways to not only continue Zoom at intensive outpatient, but even in our alumni services. And then last, I'll say is that, you know, especially with addiction, but I don't think it's specific to addiction, it really is a family illness. And at the Arbor, we do a lot of work with families. And so we've definitely wanted to continue that, but you have the issue of bringing families on property, the exposure to our clients. So what we did is we first moved our family support group to Zoom, which was easy because that was sort of an outpatient group anyway. But as far as our family program, what we've now recently implemented is once a week, we do a family education night, which is how we've modified or pivoted our family program to accommodate, you know, this new need. And the attendance is incredible. The families love it. They respond very well to it. They need it. They want it. They want to be there. And in some ways, I must say it even has been more effective. So it's been, so, you know, yeah. So amidst all of these changes, there are some really neat things that are emerging.
All this is giving me the warm and fuzzies. So it's really wonderful to hear, right? That although in the beginning there was a lot of fear that these services would essentially dwindle, it's great that the access has been open, that we've been seeing more interaction and hopefully even more, you know, more acceptance and better outcomes with offering these services. So let's change, although very similar to what you were talking about, Sandy, with our communities needing to be in forced isolation. How has this affected not only those battling an addiction, those that have been in recovery a short length of time or even a very long time, and mental health? How have you seen your clients been affected, if at all, during this self-isolation? So Debbie, you can go ahead and answer that.
I'll take that question. So for those folks, sometimes we are the only person that they actually talk to week after week. So we know that isolation can be very difficult on, you know, even the most mentally healthy of us. And certainly during this pandemic, it's escalated some of those folks. So we've gone to options to maybe meet with that client either twice a week or even 3 times a week if that's what they need. We are only limited by what insurance will reimburse on those clients, which is they can't have more than 1 session a day, but they could have one every day if that's what they needed. But we can escalate to have, you know, a few more during the week, which I think is more the norm. And the other thing is with the folks with depression, they you know, the isolation means that they really have to look at other ways to help themselves. So it gets to the point where, you know, what are you doing to help yourself? Are you getting some sunlight? Are you going outside? Can you take a walk? So really kind of pushing that client to really take some steps that they need to be taking for their own health. You know, can they find an online yoga class? Can they meditate? Can they journal? Can they reach out and call a friend? All of the things that you would say in a normal session, but now it's even more important to have some, you know, some accountability that they're following through.
Definitely. Well, I know we've talked about kind of differences of upticks of more males seeking treatment during this time. Dr. Samuel, have you seen a difference of those that have maybe co-occurring the mental health and the substance use piece going on, or versus mental health during this time?
Yes, absolutely. So, you know, with isolation and with, you know, quarantine and isolation, some of the anticipated consequences that we think we're going to see are actually risk factors for mental health conditions. So some of the anticipated consequences are increased suicidal thoughts, substance abuse, gambling, which can lead to mental health conditions as well. Abuse, domestic child abuse, that can also be increasing. That is also increasing as well, along with some psychosocial risks. So unemployment, financial stressors, cyberbullying, those are all things that can lead to depression and anxiety. And depression and anxiety have been most closely associated with with isolations. One of the major consequences is depression, anxiety, self-harm, and suicidal thoughts or behaviors as well. And it's across all lifespans. I want to make sure everybody knows that it's not just in a certain population. We can see this across all lifespans as well. And so for me, what I'm seeing too in my office is I'm seeing more depression. Some of the social anxiety has definitely decreased because kids are at home and they're not being forced to interact with in environments where it has been stressful for them, but I'm seeing an increase in depression currently right now. So what I do with all of my visits is I track those risk factors that I mentioned. So I check in when I'm talking to the parents alone, I talk about what is the stress level at home? What is the employment situation at home? With kids and their families together, I talk about, what are you doing? So both Debbie and Sandy said, we need to come up with novel ways to do things. So for me, I'm coming up with some novel ways to think about their loneliness or treat their loneliness in an environment where we can't just, go to a friend's house. So thinking of these novel and creative ways where we're all brainstorming together. So I track loneliness. I ask about loneliness during my visits. Can we intervene? If a child is lonely, can we intervene early? I lean on my therapist friends to, help them with boosting their coping and their resilience as well. So yoga, I think Debbie had mentioned yoga. So what type of exercise are you doing? I check in with all of those things because those are all risk factors to make their depression and anxiety worse as well. One struggle that I have is a lot of teens don't want to necessarily talk about their substance use at home for the fear of their parents overhearing or the college students that are coming back. And so that's something we are trying to work with and making sure that they're in a private area, because just like Sandy was saying, it's really crucial during this time to help treat those kids, young adults that are also struggling with substance abuse and helping them during this time as well. So I'm trying to get through that barrier of making sure they feel like it's a confidential conversation as well. But
yeah, definitely. No, and that's great. Oh, Debbie, you want to mention something?
I'll add on to that. Sure. Yeah, for our adult clients, if they're in a home environment where there may be domestic abuse, or maybe they're just in an environment where they just don't have a private space to talk because of the children or family members, we encourage them to leave the house, to go for a drive, go sit in the parking lot of the grocery store, take a walk. We really have to teach them how to think outside the box to make their session private for them. Mm-hmm. So I just wanted to underscore, what everyone else is saying about that. We have to, it's a whole new world. So we have to kind of put these ideas out there so they can see, oh yeah, that's doable. I can do that.
Definitely. No simple kind of thought is stupid or a bad idea, right? Because with us being in the hustle and bustle of our old world, right, our normal world of coming and going so quickly, reminding us of those self-care tips, reaching out to your support group, whether it be friends, family, your clinician, your therapist, all of those things are really helpful reminders.
And so also I wanted to add that because kids are home more often, young adults, teenagers are home more often, there's more access to social media, more access to anxiety-provoking news. So also us doing checkups on, how much has your social media usage increased? How much has your news availability increased? And what are your emotions after you check in with those areas too? There's cyberbullying still. There's still low self-esteem when kids are going on these social media sites. And so just being aware of checking in on their social media usage as well and its impact on them and having them realize the impact that it has on their mood as well.
No, definitely. Great reminder. And amongst what all of y'all have mentioned, although it seems like a lot of people are benefiting quite a bit from the true outpatient telemedicine, teletherapy services, there are factors due to the isolation, due to not being able to travel, that are causing people to go into crisis, right? And maybe it may be much quicker than their normal life because they can't go to the gym and work out. They need to remember they can go walk outside or go for a run or whatever the case may be. So Erin, how do you help people when someone or individuals when they're in crisis via telehealth?
I mean, it's a very tricky thing, Natalie, right? Because it's still a very real fear that sort of going into a crowded place like a hospital lobby, you could be exposed. And so we had to think very, quickly and effectively about how to respond to the real health crisis. So we've even shifted a lot of our assessment process and our level of care recommendation process to a virtual model. You can call in over the phone or schedule an appointment for a Zoom meeting to talk to a clinician on demand about what you're struggling with. And if you're in crisis, we can help sort of be that lifeline in the moment to connect you with the services that you need. If it's with us, that's great. If it's not, we're gonna stay with you until you can get access to the services you need. So I think that that's been really helpful so that people don't, through this process of isolation, just feel like it's hopeless and there is nowhere to turn if they are in crisis. And it's been really helpful because oftentimes it just takes a listening ear, someone who is compassionate, someone that is knowledgeable about mental health issues to be a support for people in crisis and give them services that are going to help them in the moment. We have the ability with like a phone or a virtual assessment to sort of walk through what the process of seeking a higher level of care would look like so that we can help reduce some of the stigma and bias against it, especially if it's someone's first time in a crisis situation or it's the first time that a parent is calling and seeking help for the teenager that they're worried about at home. So we've been really privileged to be part of the community responding to the needs, being mindful of the health crisis, but also being there to support people who have true mental health and addiction crises.
That's wonderful because and this is just a question that I want to ask to everyone on the panel. Stereotypically, right, when people are in crisis, for example, when you break your arm, where do you go? You go to the ER or the direct orthopedic care that I hear on the radio. Those options, right, are beneficial to go to. When you're in a mental health crisis, traditionally you would go to the ER as well. So has anyone seen an uptick in maybe after-hour calls of people maybe that have gone to that crisis level, reaching out that have needed help?
So I haven't seen an uptick in crisis calls after hours, but I do want to stress that I've definitely had to deal with crises during this time, and that's when I lean on the community of therapists, of hospitals, and just collaborative care. This is what I love about our field, is that we can all come together, we all have our strengths, we can all help our clients out in different stages or different ways that they're feeling. And so that's when I will tell them to go to a hospital for an evaluation like Rock Springs, or, hey, you are struggling with substance use a little bit more. Let's look up a counselor so that you can start meeting with a substance abuse counselor as well. And so I find that I've been still dealing with crises as well, not after hours necessarily, but during, but really leaning on my colleagues and leaning on their strengths and what they can provide at different levels of treatment as well. And understanding as a physician, a therapist, when your client does need a higher level of care, and reassuring them that we would not recommend it unless we thought it was really necessary. And so having families trust us that we're making this decision, we're weighing the risks versus the benefits, and the benefits outweigh the risk. And this is why you might have a higher level of care.
Great.
Yeah, and I would add, Natalie, I mean, it's been interesting, right? So we all know that the hospitals are overrun with people who have true medical emergencies, whether they be COVID related or something to that effect. And I think that there still is sort of a healthy fear of even walking into those lobbies if you have a broken arm because of fear of exposure. So we've seen sort of an interesting response here where in the past, maybe people went to an emergency room for a psychiatric crisis. We're actually seeing a little bit of a lessening of that. I think people are even nervous to go seek help in a crisis because they don't feel like the ER is a medically safe place and maybe they don't have access to other resources. So, the fear from our side as mental health clinicians is that these people are just sitting at home and suffering in silence. They're turning to maladaptive coping skills, like, sort of falling into a substance use addictions world. And it's going to be hard for them to pull out of it unless they know that there are plenty of mental health and addictions supports in their community where they can, you know, pick up the phone, schedule an appointment, and see someone on demand rather than sitting at home and suffering.
Definitely. So speaking of suffering, insurance is always a huge piece when it comes to seeking mental health and substance use services, right? Really anything medical, but I feel like there's an additional challenge or barrier that comes along with insurance, right? I know at least when I select my insurance, I don't look at what my mental health coverage is. I look at what my medical coverage is. So in this pandemic, how have y'all needed to help and or guide your clients regarding insurance during this time? So Debbie, have you needed to assist any of your clients or patients with this?
Absolutely. Insurance is always a challenge in a normal, good world. And in March, it really did become quite confusing. There's a lot of messages that were being sent out by those insurance companies directly to the clients. We saw stuff on the national news. We were getting information from all over the place. But the silver lining is that all major insurances are paying for telehealth for mental health care. We have not seen any insurance company to drop the ball. And once Medicare took the lead, they all started following. So we did see them pick it up. There was almost a 2-week gap in March before we had this information. So I think there's a lot of nervousness and a lot of people that weren't sure. And we all weren't sure. So that's our silver lining, is that we do have coverage for all clients. And then some of the insurance companies took it to an even higher level of compassion, and they have waived the copay. And that's just for isolated cases. I'm not even going to begin to tell you which ones they are because it's few and far between, but there are insurance companies that have waived a copay. So that's a zero cost to the client to get mental health care. So it's really a win for those clients. So if anybody's out there listening, I would just say go to your insurance company and you'd have to ask them. If you're a client, just ask your insurance company, what's your status for the copay during COVID, and they'll tell you if it's being waived. Some of them are waiving it for medical treatment, but also some are waiving it for mental health. So that is our big win, but it's a case-by-case basis. We can't give an across-the-board conversation with anyone. So we have to educate every client, one client at a time, on their particular insurance policy.
Well, that's phenomenal that we've been able to gain that access to care and remove that barrier. And I know, Debbie, you into a true outpatient kind of one-on-one or family therapy. Sandy, have y'all seen the need to educate clients at the Arbor?
At the Arbor, it's a little bit different. We're an in-network provider. We do all of our billing in-house, so we really take care of it. It's the responsibility. We assume the responsibility. It's not on the clients or their guarantors. So what we've just really done is stayed on top of what the insurance companies are announcing as far as their policies and what they're willing to continue doing. At one point, we were told, the word was last week, that May 31st, everyone except UBH would be possibly discontinuing authorizing health services. That's changed, so that's no longer the case. It's now wide open again. We as an organization have begun to pursue what it would look like, what the requirements would be from insurance to continue providing telehealth services, because we just don't see that this is really a temporary thing anymore. Mm-hmm. And so what we're finding is that, the telehealth services are plan specific. The facility itself does not have to be credentialed for telehealth, but the provider of the service, and currently that's doctors and nurses, really. So we're waiting to see if maybe master's levels clinicians will get added to the list, or what insurance is going to do on that. So really just trying to take it day by day and stay in close communication with the insurance companies to see, what their updates are, because it is changing that quickly.
Yeah, ever evolving for sure. So I know we want to leave some time for any additional questions, but last question I wanted to ask, amongst, the heavy topic of mental health and substance use treatment, compassion fatigue, empathy burnout, like Dr. Samuel mentioned, resiliency is super high for healthcare normally, but obviously there's an increase even more so now with trying to adapt and roll and expand hours, whatever the case is, to help fill the gap for their clients. So for each of y'all, what are some positive self-care rituals you're practicing to avoid the compassion fatigue, empathy burnout, and build your resiliency?
Yeah, I don't mind going first there on that one. So, you know, I was listening to everyone share about, 15 minutes back, and we were talking about, how to work with clients who are struggling with this and that. And that's a human condition. It's not limited to just our clientele. And as treatment professionals, we certainly are not immune to any of those changes in mood or any of those challenges that come with these strange times. And so, the same things we suggest to our clients also apply to us. Getting out in nature and sunshine, as Debbie was saying earlier, is a huge thing for my own personal self-care regimen. I am someone who meditates. I like to spend a lot of time unwinding, taking care of me. Accessing, we as humans, and part of, the recovery process is just to connect to other human beings. And that's something I think we all crave, even when we don't think that we crave it. And so finding ways to still do that, whether it be via Zoom and just really actually using those resources, or even practicing social distancing, whatever's comfortable for you and a friend, to really still kind of have that connection piece, I think is really important too, personally for me. But yeah, that's it.
Awesome. Erin, would you like to go?
Sure. I mean, I would add to that, in my role here, I'm sort of, the leader of a team. And so very mindful when we were making all these shifts into tele-PHP and tele-IOP that we are paving the way for patients to get access to services. We're removing barriers, but we also have to take care of our service providers. We can't forget that these are therapists that are probably struggling with the same anxiety that everyone else in the world is about what this means. And they're dealing with the isolation factors. So we were very thoughtful to make sure that we set up still daily huddles via Zoom, where everyone can get together just almost like we are now, and still engage in a lot of case collaboration and support with each other. Because as Sandy said, we're used to helping people through significant struggles in their lives, but we can't neglect the fact that we're also under a different kind of strain and pressure than we might have never been in our lives. So taking care of each other, engaging a lot of case collaboration. And then, personally, I get a lot of fulfillment out of spending time with my daughter and my family at home. And so doing whatever I can to sort of unwind before I hit the door, and then just being a really present, family member at home has helped me stay balanced.
I'll go next. I think self-care looks differently for different people, but I do think it's important that we all practice that in some way and daily. I encourage my clients and my families and the parents of my kids to practice it as well. And so I try my best to practice it. For me personally, my Apple Watch and the miles that it has accrued over these past 6 to 8 weeks has definitely increased. So I've been doing a lot more physical activity during this time. And, along with the physical activity, what I've been doing is doing virtual walks. So when I'm walking, sometimes I just want to hear the sounds outside, but other times I'm actually connecting with one of my sisters or a friend or a family member, and I'm actually doing a virtual walk with them where we're just talking on the phone to each other. And so I'm getting that type of emotional piece, but then also some physical activity related to that as well. I think for psychiatrists especially, most of us are solo practitioners. And so we actually enjoy having our families come in so that we're seeing people face to face and that we get to see other people. And so for me, I'm trying to also stay connected to friends and family members through televideo and even through, seeing people 6 feet from afar on driveways. And so I'm also trying to get that piece of being able to see people a little bit more frequently as well, because it can be isolating as a psychiatrist, a solo practitioner, and then not really having families come in as well. I have my twin that works with me, so I'm not alone, but just for psychiatrists, most of them are solo practitioners. So it's important that I think that they practice, getting some self-care as well, and being around people in a safe way, in a socially distant way. So.
And what about you?
Yeah, to add to what everyone else has said, I don't want to repeat everything. I was a solo practitioner for 8 years before I partnered with Thriveworks, and now there's about 50 of us working together, including our admin team. So we do break off into teams and have Zoom meetings and stay in contact and, you know, keep the conversations going just to help with their own stress or anxiety. You know, when we were worrying about, is insurance going to pay for our sessions? Oh my God, that was a huge stressor, huge. All the work we were doing, and at one point we weren't sure if insurance was going to pay for it. And now the next question is insurance going to continue to pay for it? We're waiting for that answer to be the silver lining on all of this. So I provide a lot of support to our therapists in that work environment. And just like Dr. Samuel said, we all have different ways to have that our own self-care. I've got 2 dogs. We go for walks. They're very funny little creatures. They just give me a lot of joy. So it's a lot of fun. Family time, you know, everything that you guys have said, and we encourage our therapists to do that. My therapists also have that ability to make their own schedule. So because they're not restricted by office hours or sharing an office with someone or anything else, they have full autonomy to create the schedule that works for them. So if they want to take a break in the middle of the day and, you know, take a 2-hour lunch, no one is saying anything. It is perfectly fine. They can do what they need to do, and they can break up their schedule however best fits their personal needs, their family needs, and their own self-care needs. And then I kind of monitor my clinicians too. I have one, I'll be honest, she's a very hard worker and she's putting in too many hours. And I told her, I don't want you to get burnout. So I kind of help to coach the ones who are very overly empathetic and they're very caring and say, look, you have to have the balance. And she goes, oh yeah, you know, I know, but thanks for reminding me. So I think sometimes as the business owner, we have to kind of look out for our team too, so that they don't overstretch. So I'm really glad that we have the team for that reason. I think it's a lot harder to be a solo practitioner in these days. So if you are a solo practitioner, reach out to other folks so you can have your own peer consultation group, maybe, just so you can decompress, because we need to do that in a normal situation too.
And I like how you said balance, Debbie. I think that's so important that, you know, our families are probably seeing this new balance in their lives, and we ourselves are seeing a balance as well, where we're balancing time with our families, time with our work. And so I'm hoping everybody can find that balance during this time. And that's part of self-care too, is finding that balance.
Definitely. And a couple of questions to finish us up for today. And Debbie, I'll direct it towards you. Have you, since you spoke mainly on the insurance piece for outpatient, have you seen any major insurance carriers reimbursing or having issues, reimbursing for teletherapy visits?
We've not seen any long-term issues. We've seen a few hiccups, I'll just say that, but in the long run, they're all coming through. Yeah. The only barrier that we see sometimes is if the Wi-Fi doesn't work. You know, if the technology isn't working, that could be on the client side, it could be on the clinician side. You know, if their internet goes down, we use all HIPAA compatible software. And, you know, if that goes down, the HIPAA folks have said you can actually use a telephone. You can use another non-normal HIPAA approved, you know, software or telephone to have that session. So that is a real blessing that those restrictions are gone. So that is one of the barriers that we've seen more than anything. It's not insurance now. It's more sometimes the technology could fail. I mean, when you talk about people that live in the really rural areas, sometimes their cell phone service is not good either. So that's part of what they have to kind of work around. And again, if it's bad, then drive to the end of the road. Go a little farther where you can get that good cell service so we can have our session.
Definitely.
Yes.
I'm glad to hear that.
Sorry, insurance is covering, I want to stress that, telephone visits as well, for medication management as well. So some people can't do the face-to-face even on the televideo. And so I think it's important that they're actually covering telephone visits as well. So
that's truly fantastic. So maybe I shouldn't have knocked insurance so much earlier when I asked my question. So I know we're right on the cusp of time, but 2 quick questions. One is, are any of y'all or your agencies providing EMDR services over telehealth? And what experience are people having, if so? And are they having just as great as an experience over the screen than in person?
Yes, we are. And yes, they're providing the same services and they're having good results.
Awesome. That's great. So Thriveworks, if anyone's needing EMDR services. And then another question, the last question that we were asked, where would you refer a patient struggling with co-occurring depression and substance abuse diagnoses for inpatient treatment? I mean, I would say here.
Yeah. The Arbor may be a good fit. Am I able to answer that? Yeah. I'll type an answer here. So the Arbor, and then here's my phone number. You can reach me directly and we can discuss it further if you'd like and make sure it's a good fit.
Perfect. Yeah, so again, reach out, whatever the case may be. I know we're right at 2. Any other questions?
Well, we're a paperless office now, so all of the records that people used to keep in the file drawers, we had gone paperless 5 years ago. So everything we do is through the web anyway. So again, we're providing those same services. Clients can even book an appointment online through our web pages. They can go to the Book Now button and it's super simple. They can pick the date, time, the clinician, and make an appointment. So we're making it as accessible as possible.
Yeah, I'm loving this technology accessibility during this time frame. So I'll hand it over to Elizabeth. I know we're right at time. Okay, here's one more. How are you all managing groups HIPAA acceptability?
Well, Zoom is HIPAA compliant. That's the short, easy answer. There are other platforms that you could access that are HIPAA compliant as well. So that's pretty much it.
Yeah,
we
just
do
to add
have a
briefly to
patient
that.
portal. Our electronic health record has a patient portal where we can have them sign documents electronically. So that's how we do that piece.
Erin, did you want to add something real quick?
No, I was just going to add to what Sandy said. Absolutely. It's about managing the expectations and informed consent up front. I mean, the same rules apply in terms of confidentiality and information if it's an in-person group or, a virtual group. So we just share that with the patients who are entering the space.
Definitely. Perfect. Well, thank you ladies for joining, and I will hand it off to Elizabeth to wrap us up.
Yeah. Thank you again so much for joining us. This was so incredibly informative. We are recording this webinar. It will be posted on the Breaking the Glass website. As well, I will be sharing it with all the panelists. A follow-up email will be sent out with everyone's contact information and resources that they want to share. So we're really excited about that. Once you close off the webinar, you will be pushed to a SurveyMonkey. Just let us know how we did. We'd love to get all that feedback and definitely provide more programming, and we just really want to hear what you have to say. So thank you again so much. And then I forgot to do this before we started, but I'd love just all the panelists